Hi, I'm Dr. Marshall Partington, and I wanted to take this opportunity to teach you a little bit about Botox. We've all heard of Botox, many of you have had it. I want to make a couple of points about it that you may not be aware of. Number one, it is strong stuff. Okay, I'm going to open up this new bottle of Botox here, and I love to do this with patients. Just show this bottle. Look at that. That's 100 units of Botox. Look at that, 100 units. Well, like, it looks empty. And in fact, it is empty except for this teeny white film that you probably can't even see. Teeniest white film. That is the Botox. That's 100 units of Botox. And that doesn't really come alive to work for us until we mix it with saline. So we put preservative-free saline in there at a very specified amount. And this is where part of the art comes to. If it's over-diluted, then you're not getting what you paid for potentially, or it has too much dissolving in your face and may add to problems getting in the wrong places. So the specific exact rate of dilution is very important. So once we've taken a new bottle and we put solution in it, then it's what we consider the regular Botox where it's liquid. This one still has a little bit. We've used quite a lot of this bottle. So that's point number one. It's very powerful stuff. Strongest neurotoxin we know. So let's talk just a little bit about how Botox works. We know it works as a neurotoxin, but what does that mean? Basically, it means it is paralyzing the muscle. Okay, so how does a muscle work? All right, let's pretend that my arm is the muscle, all right? And it's our brain that tells the muscle to move, right? So we have nerves from the brain going down to the muscle. Well, on a microscopic level, at the end, at the surface of the muscle are these receptors, okay? And the nerve comes in and stays nearby this receptor, but actually it doesn't touch. It's not like an electrical force going across here. Indeed, when we think about moving, making an expression or moving our arm, whatever, we're actually triggering a chemical release from this nerve ending that then these teeny little vesicles of neurotransmitter go across this gap and then stimulate this receptor. And so when these chemicals released here and they're received here, they signal the muscle to do the contraction. When we inject Botox just in the right places in the muscle for the right expression modulation, we're actually blocking this receptor. The Botox basically shuts this receptor down, so there's no chemical contact, there's no communication, and this muscle doesn't get, at least the fibers associated with this receptor, don't get the message to contract. Now, how long does Botox last? We usually say about 3 months. Why is that? Because it's not because the Botox then wears off and suddenly this receptor is open for business again. In fact, the muscle very cleverly creates new receptors, waiting during that 3 months as it grows back sort of from the injury of the Botox, a new receptor. And so new muscle receptors are available to have that signal go again through them and then actuate that muscle. So basically, sometimes people say, well, my Botox only lasted 2 months. What happened with that? Assuming that it was done properly and that it was done with the right amount of dosage and placement, it's because they've grown receptors very quickly. Some people grow receptors back faster than others. Some people, actually, if they've had Botox for a long time, they're slow to get those receptors back. And they may say, I get 4 months, I get 5 months out of my Botox. It's thought that it's probably about that receptor bounce back. How often, how soon that they can regenerate receptors that they'll get that signal again. Now I want to show you how we use Botox, how it really works. So here is a picture of a person without their skin. We can see their muscles. And if you look closely, these are sort of artist rendition about muscles here, here. These muscles act to pull in this direction. These muscles act to lift up in this direction. And then, of course, there's a circular muscle around the eye. This one pulls down like this. Okay. And this is one of the many groups of muscles that create facial expression. And when we use Botox, we want to adjust facial expression, usually not get rid of it, but take away the bad expressions. Okay, big principle here. Wherever there's a muscle perpendicular to it is a wrinkle. That symbol says it all. muscles are perpendicular to the wrinkles. The wrinkles run perpendicular to the muscles. What does that mean? Here is a muscle. It runs in this direction, perpendicular, 90 degrees to it, is here. And that's why we have those wrinkles in our forehead, because these muscles are pulling the skin up, and they're essentially wrinkling the skin. They're ruffling the skin up. What about here? Perpendicular here are these guys. Those are the 11's lines that people know, right in the middle of their eyebrows. And how about here in the circle? Perpendicular to a circle is a ray, these lines out here, and those are the smile lines. So if you think about it, wherever you see a wrinkle, it is acting perpendicular to the muscle. When we use Botox, we have an opportunity to go way beyond what many consider just sort of a cookie cutter approach to Botox, saying, well, on the forehead we put dots against along these lines, or we put a certain pattern someplace. The key thing is to really look at the patient. Every patient is different, and all of our expressions are different to a very minute degree, but enough that makes the difference with a really beautiful result with Botox. So I always will ask a patient to do their frowns, to move their skin, and when they do, I can see exactly where this muscle lies underneath the skin. These muscles are interesting in that they attach to the skin and they pull the skin down to bone, so that they are actually furrowing the brow. They're doing all these different lines of expression. If we look very carefully, then we can know exactly where to put the Botox. So I will usually find out exactly where that muscle movement is, and then I'll use a pen. This is just a wipeable pen, and it's the same thing on the skin, it just wipes right off. But then we can be very precise about exactly where we want to place Botox. And not everybody's pattern is the same, because everybody's face is a little bit different. So by using the pen and looking exactly what their expression is, we can really customize Botox for their want and need. Some people are familiar with this idea about the so-called liquid facelift. And what's that about? Well, the liquid facelift consists of a number of different approaches to the face that are all, of course, non-surgical. Fillers, which we are not discussing right now, are very different from Botox. Fillers are like a Bondo type thing, where we put filler in to plump up the skin in some way, to lift up a depression, or to soften the shadow of a wrinkle. Botox actually stops motion. So again, fillers are just what they sound like, fillers. Botox is a paralyzing agent. And if we're clever with it, we can be artistic and actually sculpt part of this facial expression. So if I draw something like this, basically is like a seesaw, right? So seesaw representing going up and going down. Well, we've talked about how different muscles have different directions that they pull, all right? These muscles pull like this. So if we want to do something like effectuate a lift of the eyebrow, as an example, that's something that many people like to do, have their eyebrow lifted, have that eye widened open. Then what we want to think about is weakening the down pull on that eyebrow. These muscles that are pulling the eyebrow down, if we weaken this down pull on the seesaw, we're effectively strengthening the up pull. So this will represent an actual raising of the eyebrow. And depending on whether we want the central portion of the eyebrow to be raised, or the lateral portion, or the whole thing as a unit, we can be very clever with the placement of Botox with this principle of weakening the down to strengthen the pull up.